In this video today, we are talking about the signs and symptoms of IBD, otherwise known as Inflammatory Bowel Disease. This includes ulcerative colitis, this includes Crohn's disease, and this includes inflammatory bowel conditions in between that don't really quite fit in either camp. So this is the topic of the video today. A lot of people suffer with these signs and symptoms in silence, so let's shine a light on it. Now, if you're new here, welcome to the channel. We discuss medical topics and lifestyle. So let's start off with some wild facts. In the USA alone, 1 million people in 1990 had inflammatory bowel disease. This has ballooned up, and this has ballooned up into the range of 3 million people in 2022. So it's jumping up in the same way that it's jumping up in many other westernized nations. So Europe, Asia as well. So we have it in Scandinavia, the UK, we have it in Japan and South Korea. So why is this happening? Why is the prevalence going so high up? It's a question we can talk about in another video, but these are just some illuminating facts to show that it is rising. Like we just pointed out, a lot of people do suffer in silence with it. It's not as mainstream as other major illnesses, but it certainly impacts the quality of life. Some would argue that these people are disabled as well, but that's a topic for another day. So when it comes to inflammatory bowel disease, we won't be talking about the genetics that play a role here. We won't be talking about the gut microbiome, which plays a role here, and inevitably diet and lifestyle, which plays an enormous role. So we're just going to be focusing on the signs and the symptoms, some of which will shock you. But in future videos, we'll be talking about causes. We'll be talking about how much diet plays a role and the garbage we're eating in the so-called SAD diet or standard Americanized diet. So let's get into the signs and symptoms in this video. So let's imagine that we have a gentleman coming to see his family medicine doctor. So let's imagine that this gentleman is in his 20s. He's coming by to see his family medicine doctor because he is having some symptoms that are bothering him. So what is bothering him? Well, he has a 6-month history of intermittent diarrhea. Occasionally, he gets some bloody stools, so some blood in his stools. He has abdominal cramps, he's lost a little bit of weight, and he's overall fatigued. He's tired. In terms of a family history, his mother suffers from IBS, irritable bowel syndrome. His grandfather and his uncle both had colorectal cancer, so there is a little bit of a genetic play there. He has no significant other past medical history, and he's not taking any other medication. So what are we actually going to do for him? What's this family medicine doctor going to do to him? He's going to examine him. He's going to do a blood test. He's going to do a stool test. And the doctor is going to order a calprotectin test. So see our other video regarding calprotectin and what that means. So when we talk about inflammatory bowel disease, we mentioned ulcerative colitis. We mentioned Crohn's disease. So that is an umbrella term. Inflammatory bowel disease is an umbrella term used to describe a group of disorders that are chronic inflammation of the gastrointestinal tract. Overall, they are increasing, and there's 2 peaks of incidence. So the ages of 15 to 30 and the ages of 60 to 80. So there's 2 periods where you're going to get it. Why it's named Crohn's is because a guy named Crohn discovered it. He was a U.S. gastroenterologist. Why it's called ulcerative colitis is because the name is self-explanatory. Colitis means colon inflammation. What are the areas that are affected? So the areas that are affected in general, we think about the GI tract, the gastrointestinal tract, and that goes from the mouth all the way to the anus. So that is the gastrointestinal tract. When we're talking about ulcerative colitis, it is continuous. So there are continuous ulcers in the colon. It only affects the colon, and it always involves the rectum. So it's always affecting the colon and only the colon. So it doesn't extend to the other parts of the GI tract like Crohn's disease. So that affects any part of the GI tract. And as you can see, there is skip lesions, so lesions that skip around. So it doesn't just start from the rectum like ulcerative colitis and kind of progress upwards a little bit and only involves the colon, but this skips around and jumps around. So inevitably, it's going to be a little bit different in the way it presents to ulcerative colitis. And in terms of how it presents, we're going to split it up into 4 categories. We're not going to talk about complications. We'll leave that for another video. But we're going to talk about the signs and symptoms, GI signs and symptoms, systemic signs and symptoms, associated conditions, and what we see on examination or what we can see. There will be a lot of overlap, but I'll try to highlight what's a bit more specific to one or the other. So when we're talking about GI signs and symptoms, we have diarrhea. That's a common theme. So loose bowels, diarrhea. Ulcerative colitis, it will be more blood and mucus. Diarrhea in Crohn's disease, less so. Ulcerative colitis can present with fecal incontinence and fecal urgency. So we need to go really bad. Tenesmus. So tenesmus we'll talk about in a second, but we can also have lower abdominal pain. So tenesmus is actually a term that not many people are familiar with, but it's a persistent and painful desire to evacuate the bowel despite having an empty colon. So it's that urge. In Crohn's disease, we can have symptoms and signs of malabsorption, crampy abdominal pain, mouth ulcers can occur, bowel obstruction can happen, fistulas can happen, abscesses can happen, because it's not confined to the colon, it's a little bit more outside of it and can present in different ways. But these are generally the signs and symptoms from a GI point of view that can present in inflammatory bowel disease. What can we see on examination? So what can the doctor see on examination when you're getting examined? So the mainstay is going to be an abdominal examination for both. So you can have abdominal tenderness. You can have signs of weight loss, so that's important to note. And you can have signs of anemia if there is bleeding. So you can look pale, you can have an increased heart rate, you can have a headache. In Crohn's disease, what's a bit more specific is a mass in that right lower quadrant, right iliac fossa. You can have clubbing, you can have aphthous ulcers in the mouth as well, and you can also have anal and perianal lesions, such as skin tags, that can be present there. So these are things to note when it comes to Crohn's and ulcerative colitis. So ulcerative colitis more focused on that rectum area where the symptoms are more prevalent there versus Crohn's, which is a bit more widespread. Then we move on to systemic signs and symptoms. What's going on there? Well, we already touched upon it, so it's going to be focused around the malabsorption and the unable to digest the food that we're eating, the nutrients and the minerals, which will result in weight loss, which will result in fatigue and tiredness, which will result in fever. So this is what's going on from a systemic point of view, so the person can appear generally unwell. Then you have some associated conditions, which are pretty interesting to note. And this is where, again, there's some differentiation there. So you can have affecting the joints, you can have an affection of the eyes, it can affect your liver. So when it comes to joint disease, you can have arthritis, sacroiliitis, ankylosing spondylitis. When it comes to eye disease, iritis, uveitis. Skin changes can occur as well, where you can have pyoderma gangrenosum and erythema nodosum. So erythema nodosum is what's there in the picture. And when we're talking about liver disease, you can have autoimmune hepatitis, so more focused in ulcerative colitis, along with sclerosing cholangitis, and you can have gallstones as well. I'm not going to dive into the definition of each of these conditions. We'll do other videos on that. But these are the associated conditions that can occur with inflammatory bowel disease. Some more focused with Crohn's disease, other more focused with ulcerative colitis. But just keep in mind, ulcerative colitis is confined to the colon. So signs and symptoms and associated conditions in general that are a bit more widespread are generally involving Crohn's disease. So how are we going to assess the severity of these signs and symptoms? So for Crohn's disease, we have the Crohn's Disease Activity Index. We also have the Harvey-Bradshaw Index. So that's very important. You can kind of put yourself in a category if you're having symptoms, and ulcerative colitis also has its own similar one. So these are very important to see how we are doing and assess the severity of it. Feel free to take a screenshot or find these online or find other similar ones online. These can put you in a category and tell you how severe it is and when you need to seek help. So that's it for this video. I hope you learned something that was informative about the signs and symptoms of inflammatory bowel disease. We're going to cover a lot of other topics in future videos, but this was it for this video. Please like and subscribe for more. It really goes a long way in helping the channel, and we hope to see you in the next video. Take care.